Hello, this is Dr. Tomassini from Spinal Performance, and today I'm going to be talking about spinal disc issues. So what's a disc? Well, a disc acts like a shock absorber in between the bones of the spine. This is this. Outside, there is cartilage, and in the inside, there's a gel called the nucleus pulposus. Okay? When the disc is healthy, it's thick enough to take the loads that you put on your spine and to protect the nerve, okay? When you start to have degenerative changes, the disc now gets thinner and it can start to bulge to the nerve and to the spinal cord, and that can lead to numb sensations, tingling sensations, burning sensations, pain, radiating symptoms down the arms if it's on the neck, radiating symptoms down the legs if it's on the lower back. If you don't do anything to correct that, that will lead now to a herniation of the disc. That happens when the cartilage breaks away, the gel now goes out and puts direct pressure on the nerve. More symptoms, more pain. Usually when you have degenerative changes on the disc, you will start to see degenerative changes on the bones as well. Now the bones is not smooth anymore, and that can lead to osteophyte or spondylosis, right? If you don't do anything to correct that, then this will keep degenerating, right? And that will lead to fusion of the spine, more osteophytes, and that can lead to a sequestered disc. A sequestered disc is now when part of the disc breaks and now goes all over the area. It can go to the spinal cord, to the nerve root, or other areas of the spine, and that can lead to a lot of pain. Now, by this stage, the only alternative is surgery. That's what you want to avoid. This is the last option, surgery. Now, remember that the disc is shock absorber, but think about it as a jelly donut, okay? Now, if you have poor posture, or if you have misalignments on your spine, say something like this, you're going to have uneven pressure on the disc. So if I put pressure on a jelly donut in one side, the gel wants to go to the outside, right? So let's say this is my alignment of my spine, and you see how the disc is going to bulge, right? If you don't do anything to correct that, again, this will lead to a herniation of the disc right there, right? And that's really, really, really painful. When you go to the doctor, he might do an X-ray. What we see on X-rays? Well, we don't see the disc, we don't see the nerve, but this gives us a lot of information about how your spine is aligned and how much space you have in between the vertebrae if the disc is compressed. Now, in this case right here, I'm seeing this patient from behind. This is the right side, this is the left side. The spine should be there on the green line, and the red line is her alignment. So she's shifting to the left. And you see what I'm talking about, that the disc is now like that, okay? There's compression here. There's not much space in between the vertebrae. So that tells me that there's degenerative changes, and this might be putting pressure on the nerve. And I see the osteophyte, the spondylosis, around this area right here. Another thing that can be done is an MRI. An MRI is much more expensive. It can give you a little bit more information as well. Now here we do see the spinal cord and we see the disc. Okay? This white stuff right here, that's fluid. That's the cerebrospinal fluid around the spinal cord. And these white spots in between the bones, that's the disc. This is fluid inside the disc, the gel that we were talking about. Now you see that when we go down on the spine, this one looks black and this one looks black. That means that it has lost a lot of fluid, okay? And this one specifically is bulging now to the spinal cord. That might be causing pain, that might be causing nerve pressure, okay? Now, you have to be really careful with MRIs and X-rays, especially the MRIs. MRIs give you a lot of information, and it might give you false positives. By false positive, I mean that you find things in the MRI that is not causing any symptoms, not causing any issues. And that's why we see a lot of unnecessary surgeries. You see a disc that is bulging and you have pain, so the doctor might think, okay, so we need to do a surgery. That's why surgery should be the last resort. Your doctor should do a good consultation and a good physical examination to pinpoint where is the problem. The problem might be coming from the disc, but the problem might be coming from your facet joints, these joints right here, might be coming from the sacroiliac joint right here. It might be coming from a muscle, from a ligament, from a tendon. So it's really important to do a good examination. Now, what can help? Well, chiropractic can help, and I'm going to explain how. Okay, so how chiropractic can help spinal disc issues. So the first thing that I'm going to look is for restriction of movement on the joints or misalignments on the joints. When the joints are misaligned, let's say this is the one, there's going to be a restriction of movement. You cannot move completely. There's going to be nerve pressure, muscle tension that can lead to pain as well. So I'm going to look for that restriction and adjust it with my hands or other tools that we have here at our clinic. The goal of the adjustment is to allow the joints to move better, reduce the nerve pressure, reduce the muscle tension. After that, at our clinic, we have another technique called flexion distraction. Okay, this is a type of decompression of the spine. So you'll be laying down, facing down on the table, and the table is going to flex. When it goes down, it decompresses the spine and extend. So you see that when it goes down, it will stretch the spine, opening up the space where the disc and the nerve is, decompressing the spine. So let's say this is decompression, and when it goes down, this is the decompression of the spine. So you remove the pressure from the nerve, opens up the space where the disc is. This is really good. You have a lot of pain relief when you do this technique right here. Now let's say you have a misalignment on the spine, like scoliosis, you're bending to one side. Remember that the disc is like a jelly donut, right? If you bend this way, the gel wants to go that way, okay? So what I'm going to do here is bring the table to the opposite side, so the spine now is doing this, okay? So let's say do like that. I'm going to do exactly the opposite to bring some fluid into the disc. So that's one way that chiropractic and flexion distraction can help. After we do the adjustment and after we do the flexion distraction, we go to the rehab area to do some exercise, because we need to improve your posture. We need to stress the muscles that are too tight. We need to strengthen the muscles that are weak. Work on your core so you have more strength and you don't have all those loading pressures on your spine. So again, this is Dr. Kevin Tomassini from Spinal Performance. If you learned something and you like the video, hit the like button, share this video with your colleagues, with your family, with your friends, and subscribe to our channel. Have a great day.